Every 40 seconds, someone in the U.S. has a stroke, but acting fast can save a life. This morning during American Stroke Month, we're talking about the warning signs everyone needs to know and how prevention starts long before an emergency happens. Joining us now, CEO of Ask Me Your MD, Dr. Patricia Kelly Marsh, and Marketing and Communications Director for the Atlanta American Heart Association, Tracy Leak. Ladies, good morning. Thank you so much for being here.
Good morning.
Good morning. This is a very important topic, so there's a lot to dive into here. And I want to start with you, Dr. Marsh, just basically explaining what happens during a stroke and why it is considered such a critical medical emergency.
So firstly, thank you for having this important conversation during American Stroke Month. A stroke is when blood flow stops to the brain, and it can happen to anyone at any age. And the best way is knowing your risk and knowing how it can happen to you.
Okay, and I know we're gonna cover a lot of that ground here because there's some surprising information, I think, in there at times. But Tracy, you know, this year the American Heart Association is focusing and emphasizing the Be Fast message. It's an acronym. Kind of walk us through what that stands for and what all of this means.
So Be Fast is a quick way to remember what to do in the case of an emergency. So at any point that you are with someone or yourself and you start to notice these particular signs or symptoms, it's time to call 911. Okay. So we start with the B, which is balance. So if you have any kind of loss of balance or any ability to control yourself that way, then there's the E, which is eye or vision changes that are significant. The F is for facial drooping. A then is for your arm. If there's any kind of arm numbness or any kind of arm delay. And then the S is speech. So if you have any kind of speech difficulty, then the T is it's time to call 911.
Don't waste time.
Absolutely.
And as I understand it, the B and the E are recently
new.
added. Okay.
Yes.
All right.
We've decided to do that because those are two signs and symptoms that happen that have often been overlooked.
Yes.
And so as a community around stroke, we've worked with hospitals, community partners, and others to ensure that our messages are consistent. And with that, we want to make sure that we are covering the entire gamut of things that you need to be aware of.
Right. Missing one clue can make a huge difference. All right. Yeah, and I mean, so that is an important message, the time part of this. You don't want to wait, even if the symptoms disappear, right?
Correct, because 2 million brain cells die every minute that a stroke goes untreated. And so that time factor is so essential and key.
Yeah, okay. You know, you mentioned a little earlier on sort of the groups that are affected by this or more impacted by this. Kind of talk to us about the tendency that people think that this only affects older adults. Who are really at risk here?
Any age, and that's something I can't emphasize enough. It's any age. It's absolutely knowing your risk, knowing your numbers. 80% of strokes are preventable, and the most important number to know is your blood pressure. That is the highest risk factor for stroke.
All right, you saw me cringe a little bit.
I know.
Because I know mine's been going up a little bit, and I need to do something about that. But you know, you mentioned a very key word there, that this can be preventable.
Yes.
So tell us about some of the lifestyle changes that we could adopt that would help in that.
Managing a reasonable diet.
Yes.
And again, reasonable. We're not asking you to give up everything that you love and enjoy, but doing things in moderation, moving more.
Yes.
Avoiding tobacco use. Alcohol, again, in moderation. So all of these things are things that you can do on a daily basis and in small increments.
Yes.
Because small things, small steps make big differences.
They add up. Don't let the perfect be the enemy of the good.
Absolutely.
Oh, I love that. Yes.
All right. Thank you.
Absolutely.
I'd say I came up with that on my own, but I don't think I did. But, you know, Dr. Marsh, a statistic that really stands out to me is the fact that stroke is a leading cause of death in women, and more women than than men actually die from this. Why is that the case, do you think?
So there are a lot of different things that happen in our bodies as women. A lot of changes happen that make us more prone to having higher risk of stroke. One of the things is going into menopause. Our hormone changes and our weight changes because of those hormone changing, and obesity is a risk factor. And so we have to be even more vigilant as women, knowing our blood pressure, our cholesterol, keeping our weight in check. And so these are things that we want to continue to think about.
It all ties together. It really does. And you know, there are some communities that seem to be more highly impacted than others. Talk to me about that and why outreach is so important in these particular communities.
Yeah, so there is a disparity. African American communities often have lack of access to care, and these silent, symptoms such as high blood pressure go undetected for very long periods of time. We also see in Hispanic communities a higher rate of obesity, which is a high risk factor for stroke. That goes untreated for a long period of time. They end up developing diabetes and other chronic conditions that make their stroke risk much higher. And so we start to see these disparities in not only the occurrence of stroke, but survival of stroke.
Yeah, and that's where you come in with the outreach, right?
Absolutely.
Yes.
And so at the American Heart Association, we are very intent on making sure that we have multi-language materials. Our website is available in Spanish and English. And we work with community partners across the community to ensure that we are reaching everyone that needs our information. And that's everybody, Joanne.
That's everybody.
I mean, we really understand that this is not a racial issue. This is not a socioeconomic issue. This is not an age issue. Stroke can happen to anyone at any time.
An incredibly important message, and I thank you both for doing the work that you do. You're literally saving lives here, and I thank you for the conversation this morning.
Thank you so much.
Thank
you for coming in.
We appreciate you.
Yes, and if you would like to learn more about the signs of a stroke, you can visit stroke.org. We'll also have more information linked on our website.